Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. We're looking at the Zika virus, the virus that's been in the news lately that is spread through mosquitoes, and we're speaking with Dr. Sharone Green, who is Associate Professor of Medicine with the Division of Infectious Diseases and Immunology. What are the most common symptoms of the Zika virus?
So the most common symptoms of Zika virus infection is actually no symptoms. 80% of people who are infected with Zika virus exhibit no symptoms at all. Of the 20% of infected people who do develop symptoms, the most common is a rash, which can be very itchy, fever, swollen lymph nodes, pain in the muscles or joints, and conjunctivitis, so red eyes.
How is the Zika virus spread?
The predominant mechanism of spread is through mosquito bites. So the transmission cycle is mosquito, man, mosquito. Which is different than what we are used to hearing in the United States with West Nile virus, where birds are the predominant host. So prevention from mosquitoes is the best way to prevent it. However, what's unusual about this particular virus, which is different from other viruses in the same family, is that it appears that sexual transmission can also occur. And that's a really unique feature.
What should someone do if they believe they've been infected?
If someone thinks that they've been infected, they should obviously see their healthcare provider. There isn't any specific treatment, but it is good, especially if someone is of childbearing age, knows they're pregnant, or planning to become pregnant, to see their doctor.
Why are pregnant women particularly vulnerable to the Zika virus?
There's a strong link between Zika virus infection and problems with a pregnancy, in particular a severe problem called microcephaly in the infants. And although this is only an association, the data that's coming in from Brazil as well as the United States is starting to make this link sound quite strong.
What is the treatment?
There isn't any specific treatment. It's really symptomatic. If you have a fever, treat the fever. If you have itching, treat the itching.
We've heard that this virus has been reported in several countries throughout the world. What is the concern in the U.S.?
The concerns in the United States are predominantly in those areas that have the mosquito that transmits Zika virus. The mosquito species is called Aedes. The predominant mosquito, Aedes aegypti, is actually only in the southern United States, from Florida out to the Texas Panhandle and a couple of little spots out west. There's another Aedes mosquito that can live in more temperate environments that can live as far north as the mid-Atlantic states. But luckily here in Massachusetts, so far we're safe from Aedes. However, we also, because of this issue of sexual transmission, there is a concern that people who are coming back from areas where there is Zika might be able to transmit it, and there have been some cases reported to CDC in the United States of this happening.
How can viewers get more information on the Zika virus?
The information is changing very quickly, and the most up-to-date place to get information is through the CDC, and you can access that information through www.cdc.gov/Zika.
Is there a test for the Zika virus?
There is no commercial test for Zika. The best test right now is what we call an RT-PCR, which directly measures the virus in the blood. And that typically can be detected anywhere from 3 to 14 days after the onset of symptoms. There are antibody tests that can also be done, but Zika virus is a close relative of another mosquito-borne virus called dengue. And the tests right now are not so great from distinguishing the two, and the clinical symptoms are similar enough that really the PCR is the gold standard.